Hi, I am Dr. Aman. I am a practicing aesthetic physician. I am practicing at Delhi and Gurgaon. Today, we will be taking up the concern of aging, the aging related changes that we see on face. So, it is very important to understand as to what are the changes which age gives us on the face and tackle them one by one. So it is not only important to take care of aging changes externally, our concept is to take care of them in a 360-degree fashion, whatever we can do externally as well as internally. So then it becomes true anti-aging, so that whatever we do to the face outside also should reflect vice versa. Internally also we have to do something to make the rejuvenation in the body, to make the rejuvenating changes reflect on the face. So here we have with us a friend of ours who has gracefully consented to be on the video today. So here we can see what all changes that aging gives us. As we can see, it gives us changes in color and texture of the skin. It gives us changes in the lines. दीपक जी ऊपर देखेंगे थोड़ा सा, ऊपर फ्राउन कीजिए, फ्राउन, हाँ ये, और नीचे देखिए. These are the lines, these are expression lines. इसी के साथ साथ we can also see along with this some color and texture changes, and also we can see on both mine and Deepak ji's face changes related to the fat redistribution with time. Deepak ji, can you bend your foot? Bend. Changes with time, the fat because of gravity is pulled down. So these are a few changes which need correction, which when we correct show a remarkable change and a much better difference. It takes away our tired look, gives us a much fresher look. All of it can be safely managed without overdoing it. Sometimes there are some physicians and some patients who cross the line. When we overdo it, then things start looking strange. If we just have a little bit of a facelift on the sides, there are various techniques. If we can lift the face from the side, it looks so much better. Once we fill this hollow, it looks so much better. There are a few pictures you can see. It is not advisable to post pictures online in a video profile, before and after pictures. You can see on my personal sites also. There are a filling of this area, taking care of the color and texture of my area goes a long way in management of these changes. So as far as skin color and texture are concerned, that we can manage with simple basic things, certain medicines, certain creams to apply. Your dermatologist or aesthetic physician can give you a lot of things which you can keep applying, and it works very well. Whereas the changes that we saw of the lines and wrinkles, the deep lines, the texture of the skin, the hollowness of the face, all those need addressal by filling them up. So for filling of the hollows of the skin and for lifting of the face, there are many options. We can use things like Xeomin, which is basically, or Botox, which is basically nothing but a type of protein which relaxes the muscles. We can use filling materials. Various brands are available. These are just two representative brands of hyaluronic fillers. We can use fillers which help in filling the hollows of the skin, which also help in lifting of the face. Similarly, like these, there are ways, especially from the side of the face, which help in lifting of the sagging face. Along with these treatments, there are other firming and tightening treatments like Thermage, Ultherapy, fractional radiofrequency, and thread lifts. All of them can be combined depending on your skin type and depending on your stage, best decided by your dermatologist or aesthetic physician. I like to demonstrate a few things on my face also for a closer look, what we can and what we cannot do. So these were basically all the things, fillers, things like botulinum toxin, it can be Xeomin, Neuronox, Botox, all sorts of fillers are available. They help in filling and lifting. Then there are threads which help in lifting of the skin, shaping. We can get a V shape and a lifted kind of a look. We can correct hollows like what you see on my face also, hollows like this. Some people come that there's a dark area, we want to fill this up, the problem is not here, the problem is here, we lift it up. So these are all the options for external treatment. So here today we'll talk about both external and internal options. So the true anti-aging, the true inside facelift, we will take up in the part 2, which will entail techniques like Bretox, not Botox, the brand name which is Allergans. We use a combination of traditional Indian breathing techniques to increase oxygenation. There are certain rejuvenating herbs which we add on to the treatment for a true rejuvenation inside out. That we will discuss in a separate video with my rest of my team. So now, as you can see, the patient is almost ready and we will take them up. It is hardly a minute's procedure. We will do it. You will see how comfortable or uncomfortable it is, and it is for you to demonstrate how the treatment Xeomin or Botox or Neuronox or any other treatment works for relaxing the lines. After the treatment, what we can expect after the treatment, what happens is the lines look little relaxed. The skin looks more firmer and more ironed out.